afternoon, everyone. We are Group 4. Today we're presenting on early onset colorectal cancer in young adults and why nurses may be the missing link in improving early detection and outcomes. Imagine being 34 years old, healthy, working, living your life, and then being diagnosed with colorectal cancer. Not because it couldn't be detected, but because your symptoms were overlooked. This is the reality for a growing number of young adults. To understand how serious this issue has become, we need to look at the numbers.
Colorectal cancer is no longer just a disease of old adults. In fact, 1 in 5 cases now occur in individuals under the age of 55. Even more concerning, diagnosis is often delayed by 7 to 10 years. And this delay is critical because early detection has over a 90% survival rate.
We reviewed 3 key studies: Russell et al. On patient experiences, Galushan et al. On screening, and Waddell et al. On quality of life. Starting with the patient experiences, in Russell et al., young patients reported feeling dismissed and unsupported, with significant emotional and social impact.
In Galatians and others, researchers conducted a large randomized controlled trial with over 200,000 participants. This study examined different colorectal cancer screening strategies. The study found that combining screening methods was the most effective approach. However, overall screening rates remained low. So even though effective tools exist, they are not being used to their full potential. Beyond screening, the broader impact on young patients is also significant.
In Waddell et al., a systematic review of over 18,000 young patients was conducted. The study found that younger patients experience significantly higher emotional distress, financial burden, and relationship challenges compared to older adults. Together, these 3 studies highlight serious challenges in early onset colorectal cancer. However, despite all this research, something critical is missing. Russell et al. Focused on patients, Galusian et al. Focused on screening, Waddell et al. Focused on quality of life. But not one of these studies asked nurses. There is no Canadian research exploring nurses' experience and no qualitative study focusing on the nursing perspective. And yet, nurses are often the first point of contact. To address this critical gap, we developed our research proposal.
Building on the gaps identified in the Russell et al., Galusian et al., and Wada et al., we developed a research question. An aim to explore how an education program impacts nurses' knowledge, confidence, and clinical practice when caring for young adults with colorectal cancer. To make our research question clear and focused, we used the PICO framework. P is our population, which is registered nurses in acute care settings. I is the intervention, our early onset colorectal cancer education program. C is the comparison group, which includes the nurses who have not received the program. And O is the outcome, which is improvement in knowledge, confidence, and clinical practice. This framework helps ensure our proposal is structured, purposeful, and directly addresses the gap we identified. We propose a qualitative phenomenological study. As demonstrated in Russell et al., this approach allows for a deeper understanding of lived experiences. However, our study shifts the focus from patients to nurses.
Our study has 3 key components. First, a phenomenological approach focusing on nurses' perspectives and experiences. Second, semi-structured interviews allowing nurses to speak openly while still guiding the discussion. And third, thematic analysis using the Braun and Clark method to identify patterns and key themes in the data. This means the findings come directly from what nurses share, not from assumptions. We will then look at how participants are selected and how data is collected. We will use purposive sampling to recruit 15 to 20 registered nurses from acute care settings in the Greater Toronto Area. These include oncology, surgical, medical, and emergency units. Informed consent will be obtained, with participants given time to decide and the option to withdraw at any point. All data will be handled in accordance with privacy and ethical guidelines. Once participants are recruited, we then move into how data is collected and analyzed. Now, data will be collected through 60 to 90-minute semi-structured interviews, either in person or through secure video calls. With consent, interviews will be recorded and transcribed for analysis. We will then use thematic analysis to identify patterns and key insights, ensuring findings reflect nurses' true experiences. Participants would also review findings to confirm accuracy. Finally, we will consider the risk involved and why this study is important. Like any research study, there are potential risks to consider. These include psychological discomfort when discussing experiences, as well as concerns around privacy and confidentiality. To address this, participation is completely voluntary. Responses are anonymized and all data is securely stored in compliance with privacy regulations. Participants can also skip questions or withdraw at any time without any consequences. Despite these risks, the importance of this study is significant. As mentioned, this study is important because early onset colorectal cancer is increasing, yet young patients continue to be overlooked. As shown in Russell et al., many patients feel dismissed, and in Wardle et al., they experience greater emotional and financial burden. By understanding nurses' experiences, we can improve early recognition, support timely diagnosis, and provide more age-appropriate care. For patients, this means earlier detection and better outcomes. For healthcare systems, it means reduced cost and improved efficiency. And for nursing, it means being better equipped to advocate for patients. And this brings us to our final message. Colorectal cancer in young adults is increasing, and too many are still being overlooked. Our study aims to address this gap by equipping nurses to recognize it earlier and respond effectively, because early detection doesn't just save lives, it saves young lives. Thank you for joining us today. Once again, you've heard from Yasmin, Najnan, Xenia, Rochelle, Venus, Farida, and Adriana. We'll be happy to answer any questions that you may have. Good afternoon.